Hello, medical community. Today, the topic of our discussion is systemic lupus erythematosus. The most common type of lupus, SLE, known an autoimmune disease in which the immune system attacks its own tissues. Damage affect the organs, affecting the skin, joint, brain, lungs, kidney, and blood vessels. Introductions. The pediatric SLE. Systemic lupus erythematosus is a chronic multi-system inflammatory autoimmune disorder characterized by formation of antibodies directed against self-antigen immune complex formation result in damage to essential end organ. Epidemiology. Although SLE affect primarily women of childbearing age. A little bit of history. Lupus is a Latin wolf word. Erythematosus means red rashes. Dr. Cazenave discovered red rashes on the patient's face look like wolf bite. Type of lupus. Systemic lupus erythematosus, discoid lupus erythematosus. Neonatal lupus erythematosus, a rare disorder that can occur in newborn babies. Scientists suspect that neonatal lupus is caused by autoimmune antibodies in the mother's blood called anti-RO and anti-LLA antibodies. Clinical features: cardiac, endocarditis, myocarditis, pericarditis, constitutional, fatigue, fever, weight loss, gastrointestinal, abdominal pain, nausea, and vomiting. Clinical features: dermatological, alopecia, butterfly rashes, mucous membrane lesions, photosensitivity, purpura, and vesiculitis. Included urticaria. Hematological: anemia, leukopenia, thrombocytopenia, musculoskeletal, arthralgia, arthritis, myositis, pulmonary pleurisy, pulmonary hypertension, pulmonary parenchyma, neuropsychotic, cranial neuropathies, organic brain syndrome, peripheral neuropathies, seizure, transverse myelitis, renal, gaseous hematuria, nephrotic syndrome, and proteinuria. Reticuloendothelial, hepatomegaly, lymphodenopathy, splenomegaly. Majority of patients have allergy of the hand. Most of frequent manifestation in child including fever, rashes, alopecia, arthritis, and renal involvement. What causes SLE? Part 1 and Part 2. Part 1. You can see the antigens, antinuclear antibodies, autoimmune response. Pathway 3. Neurological, arthritis, vesiculitis, and nephropathic. The antibodies directly against the antigens that own organs attack its own cell and made the condition is to be complications. What is causes of SLE? SLE is autoimmune disorder that develops when the body immune system begins to attack its own tissue. Cause is unknown, but likely that combination of genetic, environmental, and possible hormonal factors work together to cause SLE. Occur through the production of autoantibodies that attack person's own cells and inflammation various parts. What causes? The fact SLE can run in families indicate that development has genetic basis. However, no specific lupus gene has been identified yet. Studies suggested that several different genes may be involved in determining a person's likelihood of developing that disorder. Diagnosis. Diagnosis based on American College of Rheumatology criteria for diagnosis of defined lupus in children. 25 criteria of the list: malaria rashes, discoid rashes, photosensitivity, oral ulcer, arthritis, joint pain, swallowing mouth, sunlight, serositis, inflammation of lineage around lungs, kidney, persistent protein in cellular cast, neurological, blood disorder, immunological disorder, and abnormal antinuclear antibodies. Diagnosis based on the systemic lupus internationally. Clinical criteria. Acute cutaneous lupus including lupus malaria rashes, blue rash, toxic epidermal necrosis, maculopapular rashes, photosensitivity lupus rash. Chronic cutaneous lupus including classic discoid rash, hypertrophic lupus, panniculitis, mucosal lupus, lupus erythematosus, childbearing lupus, discoid lupus, oral ulcer or nasal ulcers. Non-securing alopecia, diffuse thinning or hair fragility, visible broken hair, synovitis involved two joints characterized by swelling or effusion, renal, urine protein creating this, serositis, typically polycythemia for 1 day, longer than 1 day, pleural effusion or pleural rub. Neurological seizures, psychosis, mononuria, multiple pulmonary vasculitis, myelitis, phleral or cranial neuropathies, absence of other tissues. Hemolytic anemia, leukopenia less than 4,000 mm per leukocytes at least once in absence of other known cause, such as Felty syndrome drugs. Immunological criteria, anti-nuclear antibodies levels above laboratory reference stage, double stranded deoxyribonucleic acids, anti-Smith, presence of antibodies to Smith nuclear antigen. Immunological criteria, antiphospholipids antibodies positively determined by positive test of lupus anticoagulant, false positive test, medium or high titer anticardiolipin, positive test, low complement C3 and C4s. Monitoring drug clinical visits should be history taking, physical examination, lab test, complete blood count, creatinine measurement, urinalysis. Results of lab tests may be perceived at disease flare, decrease in serum complement level, increase in anti-double stranded deoxyribonucleic acids, decrease in hemoglobin, increase in creatinine phospholipid like kinase, others. Treatment. Control disease manifestation. Allow a child to have a good quality of life without major exacerbations. Prevent serious organ damage that adversely affect function to the lifespan. Prevent adverse to drug pharmacopathy. Corticosteroids, oral corticosteroid patients SLE do not normally require use of systemic corticosteroid, but there are patients who have a low quality of life is given to the low doses of corticosteroid. Typically, corticosteroid helpful to discoid lesions, especially on the scalp. Corticosteroid, parenteral corticosteroids plus pulse therapy on IV corticosteroids combination. Hydrochloroquine used for skin and joint manifestation. These agents act as immunosuppressive, cytotoxic, and anti-inflammatory agents. Azithromycin, belimumab, cyclosporamide, IV immunoglobulin, methotrexate. NSAIDs. These drugs provide symptomatic relief for fever, arthritis, and mild serositis. Sunscreening. Some degree of long-term of often permanent hypertension, growth